Imagine a world where a simple combination of amino acids could protect your brain from the devastating effects of a concussion or even help you recover faster. Today, we're diving into a groundbreaking discovery that could change the game for athletes, soldiers, and really anyone facing traumatic brain injury. It's not sci fi, it's actually happening right now. Welcome back to the show, everyone. I'm Amy Robbins, and today I am beyond excited to sit down with Dr. Rob Dickerman, a neurosurgeon who spent over 25 years piecing together the puzzle of brain injuries. When I first read about his work, I was floored, not just by his credentials with a PhD in biomedical sciences and over 100 peer-reviewed publications, but by his passion for finding real solutions at the cellular level. Dr. Dickerman has a U.S. patent for Amino, a formula that could prevent and reduce the impact of traumatic brain injuries. And let me tell you, as someone who is curious about how we can heal our bodies and our minds, this feels like a game changer. But here's what's really got me. Traumatic brain injuries affect millions every year. Athletes, kids, even everyday folks in car accidents. And the ripple effects on families and lives are heartbreaking. So today, we're going deep. What if we could protect our brains before an injury happens? And what does this mean for the future of sports, healthcare, and even your own wellness routine? Well, Dr. Dickerman is here, and thank you so much for being with us today. I really can't wait to unpack just all of this with you. So let's start with the big picture here. I want to understand the problem that you're tackling and why it's so personal to you.
That's a big question. So as a neurosurgeon, we get a lot of bad head injuries. We don't typically see the person that says, hey, I got a concussion at the football game or whatever. We see the ones that get gunshot wound to the head or serious stuff. So in doing that for 20 years, the older patients, the simple falls, they hit their head, they get a subdural hematoma, and you go take it out. In 2017, we started looking at severe traumatic brain injury. And I would say 3 to 4 years, the American Association of Neurological Surgeons, which is the board, basically will come out with criteria to say, this is our standard of care. This is what we recommend doing on severe traumatic brain injury. And in doing that, I've always been big into nutrition and big into giving your body what it needs. In 2017, I wrote a letter to the board, which they ended up publishing, and I made a comment saying, as neurosurgeons, we fix the anatomy. I'll take your skull off, remove the clot, I'll put a ventriculostomy and a catheter, I'll drain spinal fluid. We do all these things to decrease pressure inside your skull because this doesn't move, right? So you hit your head, it's going to swell. So in doing all the gross anatomy part of it, say, hey, we got rid of the clot, we gave the brain some relaxation, let's let it heal. I noticed we're not doing anything with the nutrition. And actually, the criteria at the time said, if the patient hasn't eaten within 5 days, start feeding them either with an NG tube or a PEG tube after 5 days.
Wow.
So your brain's going 5 days without anything.
Yeah.
In the midst of working on brain injury and looking at what we can do at the cellular level, as you mentioned, I noticed these branched chain amino acids are very important. In my background with a PhD was biochemistry and molecular biology. The university graduates you with a biomedical science degree, but you have a certain department you work in. So mine was biochemistry and molecular biology, and we did a ton with cholesterol and amino acids. So I started looking at what amino acids are doing and how can they work. And the reason it got personal is I started looking at the literature, and we noticed patients that get a brain injury when they go to the ER, I can't remember who, they measured their amino acids. I don't remember the author that did it, but he said, hey, their amino acids are low.
Yeah. Can we back up a second, because as someone that's not a scientist here, can you tell us you said you've done thousands of these surgeries on traumatic brain injuries, right?
Yes.
So what does a traumatic brain injury look like? Not just in the medical chart. You can talk a little bit about that as well, but what does it really look like specifically in the lives of your patient? Do you have a story that really sticks out to you?
Oh man, there's tons. It's surprising. It's like real estate, location. So where you get injured, I was telling my assistant earlier how important it is to document where the injury occurred. Was it suboccipital? Was it temporal? Was it frontal? And which side was it on? So as a neurosurgeon and a neurologist, where we get injured is very important because we know what functions are coming from that area. In terms of, I'll give you the most common scenario. Grandpa's on Plavix or Eliquis, some blood thinner. So the cardiologists love keeping the blood like water, right? Neurosurgeons want it like Jello because we don't want them bleeding. Well, old people tend to fall down. And when grandpa falls and hits his head, our brains shrink as we age and the skull doesn't. So you got this peanut effect. So when grandpa falls and hits his head, the brain moves more than it would in someone your age. And so it bounces, tears a little vessel. Normal person, it would clot, but they're on a blood thinner. And it just bleeds and bleeds and bleeds until they get a big hematoma. So the most common injury for a neurosurgeon is called a subdural hematoma, which is a clot on the outside of the brain, but it's pushing the brain down, and they can eventually herniate. So that's the most common injury we deal with. And when we say thousands, that would have been the majority of the surgeries is removing subdural hematomas. Very common.
Well, I was actually shocked when I was doing my research on this that TBIs are the leading cause of morbidity and mortality in young adults and teens. Like 13 million people in the United States and Europe deal with this a year. So, I mean, why do you think that we're still not talking about this? It's such a silent epidemic. Like, what are we missing?
I don't know. I will say young men, which included me at one point, were not real smart in terms of, that's why the car insurance is higher on us, right? So yeah, we tend to do things that are smart, but when you look at it's bimodal. You'll have the 16 to 30-year-olds, and then you have the 70 and up. In the middle, we're a little smarter and we have better balance and better judgment. But why anything hadn't been done, I don't know. And the cost is exponential. So when you get a person with severe traumatic brain injury and they survive,
like the cost to treat it?
Yeah, it's in the billions, because they're never the same. So that was part of the point. I did, as an adult neurosurgeon, we did 16 and up. And so I remember a kid I had who had an injury at Lake Texoma, and they flew him. At the time I was operating in Medical City, Plano, and it's a level 1. So they flew him from Lake Texoma. He comes in, and the problem with, it's good and bad. At 16, your brain's very big, so there's not a lot of space. But when it gets hit hard, there's not much space for it to expand.
Yeah.
So took his skull off, took some of his temporal lobe out, and put a catheter in, and it's life and death. And at 16, he bounced back and is totally normal.
Wow.
You do that same surgery on a 40-year-old, they're not going to bounce back. So that's when it got frustrating. I was like, there's got to be something we can do at the cellular level. Why are we ignoring that?
Yeah.
And so that's where this research started, and that's what led to the animal studies and eventually, developing Amino Heal.
Well, you just kind of answered my question. Like, what was that aha moment for you?
I can recall it, when I started looking. It's kind of like sometimes you don't know what you're looking for until you find it.
Yeah.
And so I was just doing my normal thing, reading and looking, and I saw branched chain amino acids, the importance of leucine in the brain. There was a guy named he's still alive, Dr. Aquilani, who did this study in 2005, which for whatever reason didn't get any press. I read it because I started my career here in Dallas in 2004. So I saw the article, read it, and I was like, this is amazing. It was done in Italy. That was one reason it didn't get a lot of press. And the other thing is he only did it for 15 days. But what he did is what we're about to replicate. Took 25 years to do it. But he did a study on severe traumatic brain injury patients. He's a physiatrist, so he deals with rehab patients. He took 20 patients with severe traumatic brain injury. They got basically saline. He took another 20 patients, and they're matched. So meaning they all have the same Glasgow Coma Scale. They all have the same injury, virtually. He took the other 20 and gave them an IV mixture of branched chain amino acids. His ratio, at the time he didn't know, but his ratio wasn't optimized, but he still did it, and it still worked. He took 70% of the 20 in his group that he gave amino acid and pulled them out of a coma.
What?
Pulled him out of a coma. And so the way I got in with this group at UT Galveston, the neurologist there is the head of Brain Injury Association of America. His name's Dr. Massell. Super nice guy, very bright. He read the study, and I read the study. I felt like we were the only two in America that read it. And we started talking about brain injury, and I go, yeah, like Aquilani. And he said, oh, you read that study? I said, yeah. So now we're about to replicate his study at Houston at Herman Memorial, doing this IV mixture on severe. And if we can show what he demonstrated, it'll be groundbreaking.
Well, you saw this massive problem and you started digging into solutions at that, like we talked about, the cellular level, because let's talk about what you found. Because amino acids, like I was actually not expecting that when when that's what I heard. So let's actually talk about Amino Heal a little bit here. You spent 20 years researching how, am I saying this right? BCAAs?
BCAA, branched chain amino acids.
Branched chain amino acids. So when we say BCAAs, that's what we're talking about, everybody here. So like I said, for someone like me who's not a scientist, can you tell us why these amino acids are such a big deal for the brain and what's happening in the brain that makes them so powerful?
So leucine, which is the major branched chain amino acid, there's leucine, isoleucine, and valine. All three are important, but leucine is the most important. And that's why when we developed the patent, we put a certain ratio to optimize the leucine. Leucine is the primary nitrogen donor for the brain, and it's also the primary nitrogen donor for muscle. So when you talk about branched chain amino acids, they're in a class of essential amino acids, which to normal person means you can't make them. You have to eat them. So egg whites, chicken, and if you're not doing the fish, chicken, egg white, steak type deal, you're not getting enough. And what we found in just doing blood studies on patients is majority of them are low. And so now you take a person that's, quote, malnourished in terms of branched chain amino acids, and they get a head injury. Now they're really in trouble.
Wow.
So what we found was this study was done in America where they looked at a value of different labs, a variety of different labs on brain injury patients. They found that branched chain amino acids were low. The assumption was, oh, it's because they have a brain injury, they're not eating enough. But what it really was is they were getting injured and the brain immediately says, give me those. And it pulls them out of your bloodstream and says, I need them. So if you're not giving it what it needs, then what happens is the glutamate. Glutamate's the primary excitatory amino acid in the brain. So there's ever a test question about your brain and amino, say glutamate.
Okay.
It being so abundant and important in the brain, when the brain is injured, the response is release glutamate everywhere. Well, glutamate's hyperexcitability, and it'll just keep stimulating the neurons. And what ends up happening is it can cause cell death. Leucine, kind of like insulin to glucose.
Sure.
Glucose in the bloodstream, give it insulin, it puts it in the cell. Leucine will reverse the glutamate spike. That's what we didn't understand was going on. So when you give the right balance of leucine, isoleucine, and valine, it'll actually take the glutamate and shove it back where it needs to go, decreasing the hyperexcitability, and in likelihood, decreasing the risk for these long-term CTE, et cetera.
Yeah. So your research, though, was showing something really exciting, not just that it helps in the recovery, but it actually could prevent traumatic brain injuries. I mean, that kind of sounds like sci-fi level breakthrough right now, you know, but can you just walk us through maybe what you found in like the pre-treated mice in your studies?
I'm glad you asked. So a colleague of mine who became friends, he runs a traumatic brain injury facility in Colorado. His name's Dr. Butt. Expert in traumatic brain injury, expert in animals. And I contacted him and said, hey, I'd like to do this study, and here's why. And explained to him how I think the amino acids are working. So what we knew, and this was not my finding, this is what we already knew. We knew that if you gave branched chain amino acids to traumatic brain injury patients after their injury, it enhanced their recovery. So we already knew that.
Like full recovery?
It enhances the recovery, but it can, like Aquilani pulled him out of a coma. So we knew they were potent and we knew they had a good effect on the brain. So I thought it was logical. And I looked and I was like, why hadn't anybody done this? So I knew that the brain's pulling the branched chain amino acids out of your bloodstream. So common sense to me said, well, if I elevate your branched chain amino acids and then injure you, what's going to happen? So that's what I wanted to do. I can't do it on humans. So even though some of them you might want to, but we ended up doing it on the animals, and all the ethical stuff involved. The animals were treated very nice. They're under anesthesia, all those things to make sure they're not injured in terms of a pain. The animals that we gave it before and after the injury showed no injury. The key with that word prevent, which was really cool. And so you know how you have nutrition labels on any supplement, there'll be this little black box that says FDA states this is not indicated to treat, cure, or prevent disease. In speaking, I actually spoke to the patent reviewer in the government, and I was like, hey, this is what we're finding, blah, blah, blah. I just wanted to make sure, because when you do a patent, the attorney's doing all the talking. Well, my attorney has a PhD in biochemistry, but he doesn't do neurosurgery.
Mm-hmm.
So I wanted to make sure the reviewer, who's a scientist, knows what I'm trying to do.
Sure.
So I called him, which I didn't know you could do. And I called him. I was like, hey, blah, 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 explain the situation. And he was like, I've read it. And he goes, your allowables are about to come out. So I was like, okay, I didn't really know what allowables were. So he sends it to my attorney, sends it to me, and it says, you're allowed to say this. And he gave me the word prevent.
No way.
So
That's huge.
It is huge.
Yeah.
Yeah. So the reason is because our study showed if you gave it to them animals before the injury and after the injury, so they carried it all the way through, they didn't have an injury.
But what's going on at that level? I mean, is it making the brain stronger? What's happening?
What's happening is I'm giving the body, basically when the brain gets injured, it needs a ton of leucine.
Mm-hmm.
So we loaded these mice with leucine, nothing astronomical, just a lot higher than what you would have if you didn't take any.
Mm-hmm.
And what happens is you get hit, within seconds, glutamate's released. Well, the brain will pull leucine if you have it, and it'll take the leucine and it'll reverse the glutamate and put it right back where it needs to go. So that's what's happening on the cellular level.
Okay.
The problem is, and we've been trying to, when I say we, the company's been trying to talk to the NFL, we've talked to MMA, we're trying to get involved in these major concussion sports to say, look, these are the same amino acids you put in your muscles that are good for you. If you can load them before you get hit, you might be able to prevent the injury, if not stop it altogether.
Wow.
I know.
That's pretty amazing. So I kind of have to ask though, when you published this 2017 article, like, were you getting any pushback, and how has the medical community been accepting some of this? Because you actually recommended that these amino acids changed the standard of treatment for TBIs.
The
so
protocol,
tell me how the medical community has been accepting that.
I got a very good response. So when you do, what happened was there was this, they basically published in 2017 the criteria of what our standard of care for severe traumatic brain injury would be. And so I contacted the editor of the journal and I was like, hey, this is what I think, and this is what I think we should do. Mm-hmm. Ironically, I wrote this past month, they published an article on brain injuries in basketball players. And they're usually suboccipital in the back, which is worse. So I saw the article. There was a ton of data missing, and it wasn't the author's fault. But what I wanted to point out was, number one, they didn't mention anything about what's happening on the cellular level. But number two, the way they recorded the data. So what's happening, we want all this traumatic brain injury data like we do with cancer and everything else to say, okay, what's a common thing here we can solve? Mm-hmm. The problem is they have trainers or students or whoever on the sidelines collecting the data of the concussions. And so it's, hey, this one got injured. It doesn't say anything about where, anything. So I wrote a letter basically telling those authors, hey, this is what happened to you. This is why you couldn't get good data, but this is what we need to do. Mm-hmm. We need to have the American Board of Neurosurgery and the American Board of Neurology come together and say, this is the type of form we need for all sports to record this data. Because what happens is the team doctor, who's usually an orthopedic or a family doctor, they see him on the field and say, hey, you're out for 2 weeks or whatever, sends them to the brain person. Then we get them, and we've got all this data missing. So when you come see us, the biggest risk with a brain injury, concussions or anything else, is long-term risk for seizures. Mm-hmm. So you had an injury 10 years ago, and you come see me and you're having seizures. Well, I'd like to know where that injury was to see if it localizes to where
I'm glad you said that, because I actually was wondering, is there like a statute of limitations, so to speak, on if somebody did have a brain injury 10 years ago and they're suffering and they were to get on a product like this, are you seeing healing?
I can't say yes. I can't say that. But what I can say is I've given it to thousands of people. Mm-hmm. And I haven't had one complaint, but what I usually get, and some of these are my colleagues, they're physicians. One of them's taking it twice a day. I take it every day. Leucine is good for you, no doubt. You need it for your brain. You need it for your body, for your muscles. And so you're going to use leucine when you take it. Your brain's going to use it. Your muscles are going to use it. So what I'm finding is when the people take it, one of them is actually a broadcaster for the Golf Channel. He's a friend of mine. He was a patient, now he's a friend of mine, and he takes it before he goes on the air, and he says, man, I just feel sharper. Mm-hmm.
How long does it stay in your system?
A day.
Okay, so you do have to take it daily.
Yeah,
Okay.
yeah. It's a combination of vitamin C, which is for the antioxidant, and B vitamins. The B vitamins potentiate the effects of the amino acids.
Got it.
So it was formulated for that reason.
This is just a personal question because I'm wondering, like we've talked a lot about traumatic brain injuries, but how is this affecting, dementia patients? Like, are people looking at dementia as brain injuries, or is that just a different classification altogether?
It's not. You'll classify depending on the basis of your dementia, but brain injury, chronic brain injury can cause dementia.
Sure.
The pathology is almost the same. Same with stroke.
Yeah.
So we're doing a study right now in Fort Worth on stroke. So whether it's hypoxic injury from lack of oxygen or you get punched in the head, glutamate's released. So when you get to a certain blood flow where the oxygen's lower, then glutamate's released. So we're doing the same thing we did on the traumatic brain injury rodents to stroke rodents and saying, I think we can minimize this stroke. And preliminary data is encouraging. So yes, I think it would help these patients that are long-term out. It's just a matter of they need to try it and see.
So let's talk about real world impact here and how you see this playing out in the lives of athletes, soldiers, people that get injuries. You patented Amino Heal, and it's specifically for preventing and reducing TBI, which congratulations, that's huge that they gave you that allowable.
Yeah.
But which feels huge for contact sports and military personnel. But if you could dream big, how do you see this product being used? I mean, are we talking pregame supplements for athletes or something much bigger than that? Yes,
and I have a few athletes that I speak to. We recommend it's actually on the tub of it's a powder. We recommend 30 minutes before. So the interesting thing about a branched chain amino acids, and we had to do this in the rodents because we didn't know if rodents would metabolize the same as humans. It peaks after 30 minutes. So you take this powder, 30 minutes, it'll be peaked. And we found on a blood study we did and published on humans, we gave them Amino Heal. We took a baseline amino acid level. They take a dose, 10 grams of Amino Heal. We measured their blood levels at 30 minutes and at 3 hours. They were still elevated at 3 hours. So what you do is if you're a boxer, football player, whatever, and you're concerned about getting a head injury, a contact sport, you take it 30 minutes before you go out.
Wow.
And then if you do get injured, we say take another dose and you're still out of competition. But can you prevent the long-term injuries is what we want to do. Yeah,
absolutely. Well, I mean, that leads me to the next question. You guys have some really exciting preclinical trials starting in July of 2025. Are these human trials?
Yes, they are.
Okay. Can you talk to us about that at all?
I can, and I hope and pray the funding comes through. We'll know at the end of June.
Awesome.
But this is a group of colleagues. We're all researchers in traumatic brain injury. Herman Memorial Hospital in Houston. So they have a rehab hospital, which is the largest traumatic brain injury hospital in America. It's called TIR, Texas Institute for Research and Rehab. TIR has 150 beds of traumatic brain injury patients. We're going to reproduce Aquilani's study and say, okay, we're going to take 20 and they're going to get basically a control. We're going to take the other 20 and they're going to get Amino Heal. And we gave them 2 different doses. One got a moderate dose and one got a high dose. And what we hope and pray, like Aquilani showed 70% improvement. Actually, his data, to be specific, he pulled 69% of them out of comas. 100% of the 20 got better.
Wow.
They may not have pulled all the way out of their coma, but they got better.
They got better.
And none of the other 20 changed.
Yeah.
So what we're hoping to show is, yes, you have a severe traumatic brain injury. Some of them are 3 months out. Some of them are 6 months out. We want to see them get better. And then the question is, do we have to take this the rest of your life? Well, I take it every day anyway. So it's just good nutrition is all it is.
Well, just personally, I mean, what does it feel like for you to be on the cusp of something so big?
Fortunate and blessed, but I just want people to know about it. So I'm grateful for this opportunity.
Yeah, absolutely. That's what we're here to do, is help give people a platform and a place to share this message. But what does this look like? I mean, if these trials go the way that you're hoping, what does this potentially look like for the medical world?
Well, so in doing the patent, and which anyone that's done a patent realizes how painful it is, but you have to just do everything. So intranasal, IV, you do every which route you could possibly take it. So I did, and what I want to do is we have an IV bag. So the patients that are in comas, that's this trial in Houston, they're gonna be getting IVs. So it's an IV bag of Amino Heal.
Okay.
So we patented it for that reason, to go IV. What I want to happen, I want a very reputable company like Abbott, Baxter. Baxter used to have an amino acid supplement. Abbott has these, what is their shake called? I can't remember. But anyway, they have amino acid shakes. They're just not to the level that we are. And so what I want to happen is one of them say, hey, we'd like to take that and take it worldwide. Because what happens in third world countries that get brain injuries, they don't even have neurosurgeons.
Nope.
So
no, but what do you do in America? Do you have to incorporate it into like the standard of care and get that protocol put into, you know, every person that comes in gets X amount of bags, you know?
So if you said, what have I thought at, you know, when you lay in bed at night and you're looking in the ceiling thinking, God, what am I doing? What I thought and what I saw was it's in every ambulance. It's in every OR. Here's why. When you do a craniotomy.
Yeah.
If I'm doing a superficial brain tumor, the brain still gets irritated. So the other thing is heart surgery. A lot of patients that go bypass, they either put on a pump or they're not put on a pump, but they have the risk of what's getting called pump head. Pump head is lack of oxygen to the brain. That can be prevented by taking these amino acids beforehand, because we can raise the leucine levels to prevent the oxidation injury. And then in terms of traumatic brain injury, I think it should be everywhere. It's not me promoting product. It's me educating people to say it does work. It doesn't have to be a drug.
Yeah.
It does work.
That's amazing. So before we wrap up, I do kind of want to zoom out and get the big picture here and take us where this could lead us. So you've dedicated decades to this. When you look now 10, 20 years in the future, what do you hope the world looks like for brain injury prevention?
Oh, man, I hope it's a lot better. I think it can be better. And I think we're on the cusp. Like, this is a simple solution, which there's that KISS mnemonic, keep it simple, stupid.
Yeah.
A lot of times we bypass. There's actually a drug that they have out that they've been doing these clinical trials on just time and time again. And they go, well, we're not getting the results. We're going, leucine and amino heal bind to the same NMDA receptor that they're trying to do this drug to bind to. But we bind to it because the body can take it.
Yeah.
They're trying to make a drug to do it. I don't know why. Do they just not know? But what I hope happens is it just becomes like Gatorade, right? You associate Gatorade with electrolytes, amino heal with brain injury. And all I'm doing is giving your body what it needs and giving your brain what it needs, which you're just going to be better for it.
I love that. So I ask all my listeners, or all my guests, this so that our listeners can get some information and some words of wisdom for you. But what are your last parting words of wisdom? Whether it's life, whether it's health, whatever it is, what can you leave parting words with our audience?
Just in terms of brain injury,
whatever you want. Yeah.
Never stop learning. Yeah, I think that's the big mistake is people think after college or after high school or whatever, your learning has just started.
Yeah.
So I just tell people, keep educating yourself and keep reading, because I think that's the best thing you can do.
Well, I love that. And can you tell our audience where they can follow along with the Amino Health journey, where they could potentially purchase this?
It's very easy. AminoHeal.com. Okay. If you type in Amino Heal or Dr. Dickerman, you'll find it. We've made it very simple to find.
Wonderful. Well, Dr. Dickerman, I really appreciate your time here on the show with us today and for the work that you're doing, because it's pretty incredible. I mean, personally, I am now going to be looking into this myself
We bought you a tub.
Wonderful for preventive brain health. I mean, health is very important to me, and I know it's great that our country now seems to be on this new health kick. So I think this is something very important to incorporate into
Thank God.
Yeah,
yes.
I know. Thank God. Right. So thank you for your time,
Thank you.
we'd love to have you back anytime you want to come back on.
Thank you very much.
Thank you.